When an insurance denial puts the well-being of a family at risk, what do you do next?
Years ago, one of our kiddos needed more care, and on the recommendation of a psychiatrist, we looked into a residential program. And not long after the residential program started, we got a letter from our insurance company that said, "We're not going to pay for it. This care is not medically necessary."
It turns out denials are far more common than most people realize.
We've estimated that there are between 15 and 22 million denials every year by private insurers for mental health claims. That's just too common an experience.
Right. And
To prevent feelings of helplessness from happening to others, it was essential to build a practical tool to support families and clinicians.
If someone finds their way to our website, we want them to immediately be encouraged that you don't have to take no for an answer, and that the resources that we're going to provide are going to be accessible and you can get started right away.
While also creating a resource that clinicians consistently return to.
So the feedback is, I'd say, most robust around our medical necessity letter template. I like to think about it as a written form of a conversation that a clinician might have with an insurance company, which might be a little bit easier to conceptualize. And our website provides a template that provides a jump start to make it easier for the clinician to write that medical necessity letter.
Learn how a story of advocacy, where a family that wouldn't take no for an answer, turned their experience into tools for others, on this episode of Wellbeing Wednesdays.
hello, everyone. Mohini Venkatesh here, Chief of Staff at the National Council for Mental Wellbeing, and I'm really happy to be here today with you for Wellbeing Wednesdays. I'm joined by Joe Feldman, the founder and president of Cover My Mental Health, which helps individuals and families with tools and resources to support access to care. Joe, it's great to have you with us today.
Thanks for having me.
I'm really looking forward to this conversation today. Access to care continues to be a huge challenge in this country, specifically access to mental health and substance use care. This is something I'm personally really passionate about. As you and I have chatted about before, this was a major focus of my thesis in graduate school. While that was just a couple years ago, it's still something I think about a lot. It fundamentally shifts people's experience with their health concerns. It fundamentally shifts the experience of families. And so I really want to talk about that in more detail with you today, to just hear more about your story and what you're trying to do to help.
That sounds great. We've certainly made a lot of progress in terms of access to mental health care, but we've got a really long way to go.
Yeah, certainly. So let's start from your personal story, if you're willing to share. How did you get into this work?
So I got into this, I'll say not purposefully, but because years ago, one of our kiddos needed more care than we were able to provide at home. And on the recommendation of a psychiatrist, we looked into a residential program and determined that that was going to be the right next step. And not long after the residential program started, we got a letter from our insurance company that said, "We're not going to pay for it. This care is not medically necessary." And that was, I'd say, the beginning of my journey into advocacy to help others when faced with similar challenges dealing with insurance companies.
Right. So this isn't that unique of an experience, unfortunately. There are a lot of families, a lot of individuals that are experiencing this.
Right. Since I started Cover My Mental Health just over a year ago, we've estimated that there are between 15 and 22 million denials every year by private insurers for mental health claims. It's just too common an experience.
Right. And what's behind that? What do you think is going on there?
Well, I think there's a number of different factors that come into play. The obligation for health insurers to cover mental health is a relatively new phenomenon. And our health insurance system in this country is already relatively challenged. It's between public policies and private policies. It's quite a lot for everyone to navigate. And when it comes to mental health and substance use disorder, we have different measures of progress. And in some cases, we have difficulties measuring progress in a quantitative way that makes it easy to say, if you have, say by comparison, if you have high cholesterol, you take a medication, or you have ultimately surgery to deal with cardiovascular. We don't have those same, I'll say, straightforward approaches when it comes to mental health and substance use disorder.
Well, and going back to your family story, how did you overcome the hurdles with access to care?
So this letter was, I'll say, surprising. And at the same time, a friend had tipped me off that I was going to have trouble with insurance coverage for the care. Not long after our kid left for residential, I had breakfast with this friend. His daughter had had a similar situation, and he knew from his own experience that a denial was coming. So he had tipped me off.
I see.
And indeed, the therapist at the residential program called me one morning and said, I have a call this afternoon with a psychiatrist who is working for the insurance company, and we call him Dr. No. His job is to deny care, and this particular file, so to speak, has been passed to him. We're going to have a conversation, and then he's going to file a report that says the care is not medically necessary. She called me back a few hours later and said that's exactly what happened. So we had I'll say, good luck to be able to dip into our savings and keep our kid in the program and be able to finish that program and to get the care that was needed, and deal with the insurance company later, which we did. We filed an appeal, and ultimately we filed a federal lawsuit, which we won, and we collected a judgment to have that insurance company pay for the care they should have paid for in the first place.
Wow.
So from that, I learned a lot of things. I learned that litigation is a terrible way to enforce your rights under your health insurance policy, that there are a lot of other steps that can be taken that might be helpful to avoid litigation, to avoid even appeals. And so I've been focused from an advocacy perspective on sharing those other steps that can be taken so that you can hopefully get the care that you've paid for without resorting to, I'll say, much more challenging measures.
Well, and I think a lot about the family in these situations and all that they're having to navigate for their loved one. Circumstances, resources, time. These are all precious things not all family have the ability to stretch into.
That's certainly true.
Right. And so as you've been doing this work, can you share more of the personal side of the stories here that you're experiencing as you connect with families? How are people struggling through this?
So when we originally put the website together, coveringmymentalhealth.org, one of the things that we focused on based on talking to families and talking to clinicians is encouragement, which is to say, if someone finds their way to our website, we want them to immediately be encouraged that you don't have to take no for an answer, and that the resources that we're going to provide are going to be accessible and you can get started right away. And I think that's turned out to be incredibly important. So when I'm sharing our resources and presentations to clinicians or to advocacy organizations, like I've had the chance with organizations like NatCon, it's so important to start off with encouragement that you don't have to take no for an answer and that you can do this. It turns out that there are a lot of websites in the mental health advocacy world that focus on how the law is on your side. And it's true that there are a lot of laws at a state and federal level that are supportive of improved access to health care. But when you just got a denial letter, it really isn't helpful to know that the law is on your side. You want to know, what can I do today to get started? And so that's really been a big focus for us.
Wow. Seems like you've learned up a lot. Are you an attorney?
I'm not an attorney. I have the benefit of a lot of collaboration with attorneys who are active in this area. And in my professional career, before I retired and started this project, I did a lot of work with attorneys. And so I've been, I'll say, accused of thinking like an attorney, which I'll take as a compliment.
Well, and I'm curious also, too, about mental health parity and where we are today. What do you say to folks who think mental health parity is a myth?
Well, so the Mental Health Parity and Addiction Equity Act was passed in 2008, and regulations were put into place for enforcement of that federal law. I think that the accomplishment of that federal law was significant in many ways and disappointing in other ways. I think the ways in which it was a big positive step is around certainly expectations.
That's right.
It changed expectations for patients and families and clinicians, at least those who are aware of it, that coverage of mental health is coverage of health. It should be treated no differently. So I think changing expectations was a really big factor, or a really big accomplishment. I think another way in which that federal law has had a really good impact is its influence on state laws and state regulations. So many states have passed laws over these 16 or 17 years since the federal law was put in place to, you could say, reinforce or provide complementary requirements for health insurance companies to cover mental health. And the regulations at the state level have also been put in place to learn from the limitations of the federal law and to enforce the state laws that have been enacted. So those are all really positive developments. The challenge with the mental health parity law from 2008 is that it's comparative. So it doesn't mandate coverage. It mandates that coverage be comparable to physical health care. And that's a challenge because accessing mental health or substance use disorder care is not necessarily easily compared to physical health care. So it makes it difficult to enforce. It makes it difficult to litigate. And the way our system of government works, litigation is a really important tool to define how the laws actually work and how they work in different situations. And because this is a comparative law, it makes it relatively challenging. I think the other thing that's challenging is the law was the best possible law that could be passed at that time. And the folks who were behind it, Patrick Kennedy was certainly one of the leaders there, knew that they were going to have to provide some limitations in the drafting of that law in order to have it pass. And so they accepted that those limitations were a reality. And so they passed the best available law. And so here we are some years later with a law that is not perfect, sets great expectations, and still has a lot of work to go.
Well, and this is where really Cover My Mental Health is trying to offer added resource and guidance for people to navigate.
Right.
So could you introduce us to Cover My Mental Health, and what is your vision behind the creation of it, and how was that lived today?
Sure. So I'd say the whole idea behind Cover My Mental Health is driven by my impatience. So I'm all for advocating for better laws and regulations. And I continue to be invited to testify at a state level, particularly in favor of better laws and regulations. That's a long process, and I'm just too impatient. So the whole point of Cover My Mental Health is to provide resources that can be used at the point of an insurance crisis.
I see.
So I want to provide through the website resources that someone can use today, someone can use this afternoon to be able to push back on the obstacles that have been put in their way by their health insurance company. That's the whole goal. So I have, I'll say, maybe a near-term vision and a long-term vision for this resource. The near-term vision is that more clinicians and more patients and their families will become aware of our resources, will have the opportunity to use them and to get the care that they need with the insurance coverage that they paid for. That's the near-term vision. And opportunities like this conversation today are one more way of introducing our resources and providing encouragement that you don't have to take no for an answer. My longer-term vision is that we're out of business, that people are getting the care they need, and that the insurance companies are providing support to the clinicians who are making the decisions about what care is required, and the insurance companies are paying for that support as determined by the clinicians who know best.
And do you have a sense from feedback you get or maybe downloads on the website, what are the most sought after resources or the most used ones on the website right now?
So the feedback is, I'd say, most robust around our medical necessity letter template.
I'll say more about that.
So the denial letter that I referred to earlier reflected an insurance company having one standard for what was the most appropriate care for our kid, and the clinician was looking at a different standard. So medical necessity is a term that you'll find in a health insurance policy, and you'll specifically find reference to an insurance company saying, we will pay for claims for care that is medically necessary. So that's a legal term. It's in a legal contract called your health insurance policy. So clinicians, when they go to medical school or they get their clinical training in another venue, they don't learn about the legal term medical necessity. What they learn about is generally accepted standards. They also learn about the Hippocratic Oath, do no harm, and they learn about care that's safe and effective. That's what they're taught. And so when an insurance company says, we don't think this care is medically necessary, it can be confusing because that's not a term that a clinician is taught. They're taught to apply generally accepted standards. So the whole goal of a medical necessity letter is for a clinician to document their training, their expertise, their practice, their interaction with the patient, and the clinical standards that they are applying in this particular situation to determine the care that's appropriate. I like to think about it as a written form of a conversation that a clinician might have with an insurance company, which might be a little bit easier to conceptualize. They get on the phone and they say to the insurance company, so I'm trained in this area of, say, eating disorders or anxiety and depression, and based on my training, I've determined that these clinical standards apply, and this is what we should do to support the patient's recovery. And putting that conversation in writing is what a medical necessity letter is all about. And our website provides a template that the clinician can download or a patient can download and share with their clinician that provides a jump start to make it easier for the clinician to write that medical necessity letter.
I see. This feels like a really practical resource and tool, both for family members, but as you say, clinicians as well. They can print it out and use it directly.
Absolutely. I've had the opportunity to share this resource with literally hundreds of clinicians.
Wow.
And I get, I'll say at least a few reactions. One reaction I get is, this is fantastic. This is very logical and it's something that I can envision using. I also get feedback from clinicians who've used the resource about how they've been successful using this to get insurance coverage for their patients, which is obviously the goal here. Another reaction that I get is, this sounds like more work. And what we try to do with our template is minimize the amount of work that's required by providing a template that is a jump start to make it easy for a clinician to write this letter.
I see. And are there other resources you have created or plan to create for clinicians to really try to scale the impact of Cover My Mental Health?
So one of the resources that we offer for clinicians that they can download from the website is a summary page that they can share with their patients. So we try to reach patients through the people they trust, and clinicians are obviously a big part of that. So for clinicians who want to share our resources, we provide a one-page summary of typical obstacles that they might encounter when getting care and wanting to secure their insurance coverage. And this is a handout that physicians or clinicians or counselors can share with their patients to I'll say, help them help their patients. Another resource is a series of webinars that we offer to clinician groups. And I've had the opportunity both in person and by remote to present webinars to share our resources with clinicians so that they can become more familiar and also more encouraged that pushing back on insurance company obstacles can be successful.
Is there any message you'd want to say to the provider community about the dynamic at play with health insurance companies and what they're trying to do for their patients and getting access to care?
So I think that the most important message is to be encouraging to their patients. So when someone has made the decision to seek care for a mental health or substance use disorder issue, in all likelihood, that's a decision to seek care that's come after some time. And it's a big step. And it's so important for a clinician to be able to say to their patient, you're taking the right first step, and I'm going to stick with you through the process as long as my competence is there. And if it's limited, I'm going to help you find another resource who might have specialty expertise that can be helpful to you. And I'm going to help you to the extent that I can with resources to be sure that you're not financially burdened to the point where you decide to not pursue care. That is such an important message. A good friend of mine told me the story about how she had gone into her psychiatrist, and that psychiatrist had recommended a certain course of treatment, and that the psychiatrist said, and by the way, good luck with your insurance company. And when this friend told me this, I said, that's about the worst thing that I could imagine hearing, when you're confident that you've got the right clinician and that the course of treatment makes a lot of sense to you, and then you hear good luck. So it shouldn't be good luck. You have a legal contract, and that contract should be enforced. And the tools of Cover My Mental Health are one way that you can advocate for yourself.
Mm. And just curious, looking ahead, what does the coming year look like for you? What does it look like for Cover My Mental Health? Any new things coming up?
So we are, I'll say, with a full dance card of presentations to clinical organizations, at large national meetings.
That's great.
Which is fantastic. I'll be presenting at several conferences in person. We have a number of programs, clinical programs, who asked me to give presentations, workshops. Sometimes those are CE accredited, and we're very happy to work with organizations to provide that I'll say educational credit. I also work very closely with mental health advocacy groups like affiliates of Mental Health America and NAMI and the Depression and Bipolar, so DBSA.
Support Alliance, yeah.
The Depression and Bipolar Schizophrenia Alliance, as well as organizations that provide support around specific diseases or conditions. So those are really wonderful opportunities to reach the people who are vested with confidence of their communities, and to tell them about our resources so they can help their communities.
That's really great. Well, I'd love to close with talking about mental well-being. For me, my mental well-being means that I'm really living into what my mind and heart and body and soul is asking for, and not shying away from that, and really maintaining strong connection with people in my life that I love. So I'm curious for you, what does mental well-being mean for you?
So I think a lot about my dad when it comes to mental well-being. So he focused a lot on being with family. There was never a family event that we missed. And I can remember him saying, there's someone's getting married in California. We lived in the Midwest. Do you want to go with me? I'm going to head out there and be part of the family. So I think connection to me is at the core of mental well-being. And I think taking care of ourselves and taking care of one another is a big, big part of that. So as I mentioned earlier, getting access to mental health care or substance use disorder care is challenging. It's a challenging decision to say, maybe I need help that is not happening in my life right now, and I might need to do something about that. So to me, mental well-being is helping that recognition to live. And that can be for ourselves or the people we love or the people we work with. Because sometimes we're just blind to seeing it in ourselves, and we need the benefit of those who live around us and who love us.
Thank you for sharing that. I think we share a strong commitment to access to care fundamentally. That is what wakes me up in the morning and what keeps me up at night when I think about the mission and the work that's ahead for the National Council. I'm so grateful to advocates like you who are out there doing the good work here, trying to fight for families and for individuals, and supporting their access to care journey. Thank you again for what you do.
Well, thanks so much. So I have a habit every morning that I wake up. I open up my phone and I look at my Google Analytics to see how many visitors came to the website the day before. Because in the tradition that I grew up in, if you save one life, you've saved the world. And I like to think that somewhere on that list of the number of people who visited our website, someone's life's going to be saved, and we'll have accomplished our mission.
Wow. Thank you, Joe, for joining us. How can folks learn more, gain access to the resources we've talked about today?
Sure. So I'd invite everyone to visit our website at covermymentalhealth.org. You can access our resources there. You can also find resources under a tab called Resources for Collaborators to learn more about how we work with community organizations to share our resources. And I can be reached at the email address on that webpage. And I look forward to any opportunity to spread the word and get our resources in front of folks who can use them.
Joe, thank you again for joining us and talking about this very important issue of access to care. We share in that mission, and so grateful for the resources and the work that you're doing out in community.
Mohini, thank you very much.
Absolutely. And thank you all for joining us for another episode of Wellbeing Wednesdays.